Hello, I'm Jan Painter, and I'd like to welcome you again to our program, Politics Matters. Our guest today is David Toscano, Virginia House Delegate for the 57th District. Welcome, David.
Great to be here.
David Toscano was elected to his first term in Virginia House of Delegates in the 57th District in November 2005. David was born in Syracuse, New York, has a BA from Colgate, a PhD from Boston College. He earned a JD from UVA. David has taught at various universities, inclusive of UVA and Piedmont, among others. Has had a law practice with Buck, Toscano, and Terskirts, specializing in family law and real estate. David served on the Charlottesville City Council from 1990 to 2002, and as mayor of Charlottesville, as we all know, from 1994 to 1996. David serves on the State House Committees for Science and Technology, the Courts of Justice, and on Transportation in the Virginia House. He is also on the Disability Commission, the Joint Commission for the Study of Technology, Math, and Science. David resides with his family in the city of Charlottesville. Welcome again, David.
Thanks.
The Virginia General Assembly has, as of March 13, concluded its 2010 legislative session. We're fortunate today in having Representative Toscano with us to report the results. In particular, we'd like to focus our attention on the healthcare implications of our larger national debate, which just concluded, as everyone knows, its current phase at least, with President Obama signing the newly reconciled healthcare bill into law. If time allows, we'd also interested in hearing about any and all new initiatives in education out of Richmond, starting with pre-K, high school, college, and beyond. That is, I know, David, a particular focus for you. First, let's start with the fact that upwards of 1 million Virginians do not have any kind of health care insurance. They're working either full or part-time. And as you note in your informative website, they generally work for companies that cannot afford health care plans for their workers. And we know that the bedrock of any community is small business and their families. So David, share with us, if you would, what new state initiatives are underway to assist both small businesses and their workers with regard to health care coverage?
Well, I think it's really important that you emphasize that a lot of people who do not have insurance actually are working full-time. It's just that their companies are not in a position where they can afford to pay for health insurance for these folks and their families. Now, over the last few years, what we have been trying to do is provide more assistance to children who are not covered and to families who are of low income who have not been covered. In this budget cycle, we really hit the wall, however, because our revenues are not sufficient to keep expanding that group. And so I think a lot of our hopes for those of us who want to get more coverage are going to rest on the health insurance plan that's been passed out of the Congress and hopefully will take effect in the next several years. It's projected that many, many more people will be insured under this plan. Not everybody, but almost everybody. And that's really, really important. It's going to work in a way that hopefully will provide some options for small businesses. But all of the action is occurring at the federal level. It's going to be funded through the federal level. What we're going to have to do as a state is figure out ways that we can get some more money in the pot for Medicaid funding, because we're going to have to match the federal monies coming for enhanced Medicaid benefits in the next several years. And that's going to be a challenge for us in our budget process, because we have to have a balanced budget and the revenues really aren't there right now.
Mm-hmm. I know many people have this question on their mind, and that is if they already work for a company that supplies health care coverage, what's going to happen? I think people are understandably concerned about this.
Well, from what I understand is that if you have a plan in place now, you're going to be able to keep your plan. This is not the major earthquake that you would think if you were reading the opponents to this legislation. This is a moderate expansion of our healthcare initiatives in the country. It's much less expansive than the Clinton healthcare bill that was rejected in the early 1990s. And I think that over time we're going to see where it works, where it doesn't work, how it has to be tweaked so as to provide a higher level of coverage. But if you think about things that don't exist now that will exist with this plan, people who have pre-existing conditions will not be able to be discriminated against by health insurance companies so that they can get coverage. Youngsters who perhaps went on to college and came back to live at home with their parents can maintain coverage on their parents' insurance policy as long as they pay until they're age 26 or 27. These are very tangible things that are going to help real people right now. And over time, hopefully, we'll have more expansion that will allow greater numbers to be covered.
I think that's something that a lot of people need to realize too. It's a work in progress, and there will, as you say, be tweaks to it, improving it as we go. What kind of child preventative care, David, might be offered statewide as a result of a new initiative in Richmond or as part of the national bill?
Well, my view has always been that if you're going to expand coverage, cover the children first. It always makes sense. They're the most vulnerable part of the population. We have been trying to do that more in Virginia, and I think with the federal legislation and the funds that will come as part of that legislation, we'll be able to provide more coverage, because there's no excuse for any child being left uncovered insurance-wise in this country.
With respect to the elderly population, we have a lot of elderly people in Virginia and in this area. What options now exist for them that did not exist before, and can seniors realistically expect to get greater help with, for instance, prescription meds?
Well, prescription meds was a program that was initiated several years ago, a very, very expensive program, but created something which is called the donut hole that people are aware of, and that is that you can get coverage up to a certain point and then it stops, and it creates a hole in coverage. Now, I'm not an expert on the federal legislation, but what I understand is that the federal legislation is going to provide some assistance to those folks who are in that donut hole. It's not going to be huge. I think it's $250 or something like that, but it will be helpful to people. And again, this is a very expensive hole to fill, and if you don't want this program to be a budget buster, you have to be realistic in what you can do. And so that's what the Congress has set out initially, to fill a portion of the hole. It probably won't fill the whole hole.
No, I think it's important for people to be realistic too. We are in a crisis economically, as we all know. What plans are now in place to improve Medicare reimbursement for people?
Well, in the state, the issue with Medicaid reimbursement has been that we are at the bottom of the states. We're like 48th, 49th out of all the states in terms of our Medicaid reimbursement for physicians, nursing homes, and hospitals. And that's a situation that's unsustainable, because what will happen is that doctors will refuse to take Medicaid patients. It's difficult for hospitals to say no, because you come through the door and you got to be served. But the lower the reimbursements, the greater the burden is going to be on the rest of us who have health insurance or are private payors into the system. Our fees are going to rise. So that when people say that we shouldn't do anything to improve Medicaid reimbursements, what they're saying is, raise my own fees. And that's not really the way we should be doing it. We should try to spread the costs across the entire population. That brings down the fees for everyone.
What business incentives are in place, if any, to move the insurance companies toward a more equitable mode of operation, do you think, David?
Well, one of the things about the federal legislation, and again, I'm not in the Congress, so I'm not the total expert on this, but from what I understand, is that you're bringing in millions of people into the insurance pool. That's very attractive for insurance companies. Then again, they can spread the risk across all of these additional people, and in theory, bring down premiums for everybody. Now, some of us would have wanted more of a public option that would allow more competition in the system. We didn't get it with these bills for a whole host of reasons. And so we're going to see over time whether the insurance companies will do what they say they're going to do, and that is try to reduce fees across the board because you have a larger population you're insuring and spreading out the risk, or if they don't, whether we'll have to come back at some point and try to inject more competition into the system. Because we know how markets work. If you have competition in the system, the fees tend to come down, the prices tend to come down. And we're simply going to have to see.
Do you think that the public option idea will be revisited? Are states ever, someone asked me this, it was an interesting question, are they ever empowered on their own to have some kind of public option for people?
Well, that's a very good question. And in fact, the federal legislation gives the states the ability to come up with their own program and seek a waiver from the federal program. I think few people know this. And so you've got people like Senator Wyden out of Oregon, who had his own health care plan, and other folks around the country saying, okay, states, you don't like the federal program, innovate your own, ask for a waiver. Now, some more progressive folks are saying, well, let's take the public option to the states. I don't think you're going to see that in Virginia because of the way the politics work here, but it doesn't mean that we can't think of different options for the Commonwealth of Virginia to see if we can come up with a program that may work either in collaboration with the federal program or independent of the federal program. It has to make sure that we insure people in greater numbers than we do at present. But there are some waiver provisions in there that people might explore over time.
Along those lines, in your view, in Richmond, is there an appetite for increased creativity in terms of looking at options going forward? Are positions hardened? Is it, how easy is it for people to work together?
It's an interesting question because you hear the rhetoric all the time. More competition, free enterprise, the market, innovation, creativity. But when you look at what the legislation is essentially saying no federal involvement. And so the politics in Richmond right now are really politics of opposition, politics of just saying no. One of the first bills we considered out of the box when we went down there in January was a bill called the Virginia Health Freedom Act. You love the name.
Yes.
And it basically said that nobody in Virginia should be forced to have to pay for health insurance, and that the state was going to act to nullify any federal legislation or any federal regulation that would force people to do that. That bill passed out of the House. I think I was one of maybe 25 people who voted against it. It passed out of the Senate. It's been signed by the governor. And Attorney General Cuccinelli is using that as one of the bases for his lawsuit challenging the federal legislation on health care. So that has been the attitude down in Richmond, is essentially just say no. Not try to fix it, just say no.
You raised something, my next question was going to be the legal feasibility. Is there a sound legal basis for a challenge within the state for health care?
Well, you know, I'm not a constitutional lawyer, but I am an attorney, and I do read what other people say. As you well know, our Attorney General, who from the beginning of his campaign through the time he won until he took office, has said that he's going to fight federal, what he calls intrusion into state operations, and he will sue. And in fact, one of the things he did was sue to allege that the federal government had no regulation to deal with the issue of climate change. And about 3 hours after the bill was signed by the president in the healthcare arena, he walked across the street to the federal courthouse in Richmond and filed suit saying that the bill was unconstitutional. He did this separately from a number of other attorneys general, again, fairly conservative attorneys general across the country, who have filed suit jointly to challenge the federal regs. The Cuccinelli suit is based partly on the Virginia Health Freedom Act. He alleges that because the legislature has taken a position that we oppose the federal legislation, that he ought to be able to use that as a way to say Virginia ought not to have to participate. But he will also make other constitutional arguments that it violates the Commerce Clause, that the 10th Amendment trumps the federal legislation, and therefore the legislation is unconstitutional. The legal scholars, however, say that that's really an uphill fight, that he's going to have a very difficult time.
That's what I understand. I was just really interested to hear your take on that. Nursing. I know that many qualified applicants, as you again point out in the website, are turned away because there aren't enough schools for people. What kind of funding might go forward to address the nursing shortage that we have?
Well, the good news is that we have tried to put some additional money in the pipeline that would build capacity at institutions like UVA. We helped fund an expansion to the nursing program, the capital funds, and we helped fund some new faculty, because what we're seeing across the country is that there are a lot of folks who want to enter the profession, but there are no spaces for them in the schools. It's not a question of bringing in people who are unqualified. These are very well qualified folks who seek these slots, but we don't have the faculty and we don't have the physical plant. And so the legislature over the last few years has tried to put some more money there. Now this year we weren't able to do much because of the fiscal crisis, but I think long term we're going to have to do more, because with this new federal initiative in health insurance, there are going to be more people who hopefully will be going to physicians and nurses to try to stay well. That's part of the purpose of getting some health insurance, so that people don't wait until they're seriously ill before they see a doctor or a nurse. And that's going to increase the demand for both nurses and for doctors.
It's interesting. I know that in some countries they actually pay doctors if people stay well, which is a different kind of concept, but might have some merit. What kind of tax credits are now available to employers as incentive for health care provisions?
There are not a lot. And, you know, people, you know, for me, I wonder sometimes about tax credits, because once you put them on the books, they're there forever. You might be better off trying to fund things during a budget cycle to say, can we provide some incentives here and some incentives there, but then you review them again next year to see if you can afford them. What we're finding in the state is that there's so many tax credits and there's so many, quote, tax preferences, and we're not sure that they always work the way they are supposed to work. Take a tax preference like what's called a dealer discount. The dealer discount is a preference that has been provided to small businesses to help pay for them to collect the sales tax and rebate it to the state. Who takes the most benefit from that? Walmart. Millions of dollars. And they do the transfer of the state sales tax almost electronically now. It doesn't cost them hardly anything, and yet they get this bonanza. This is an example of a tax preference that perhaps has outlived its usefulness and ought to be examined.
There have been a lot of votes for you that you just concluded on the 13th of March. Would you talk with us a bit about some of the bills that you are most proud of? Start anywhere you like.
Well, you know, first of all, I think many of your watchers know that I'm in the minority in the House. You know, I'm a Democrat. We only have 40 Democrats in a 100-member House, and so I have to make sure I can get some bipartisan support in order to get bills passed. So a lot of the bills that I take up are really local interest bills and bills in a specialized area. I'm sort of interested in foster care and adoption. I sit on courts of justice, so that I'm in a unique position. A lot of the bills related to that go to that committee. So every year I have 3 or 4 bills on adoption and foster care that I put in, and I'm very proud of those bills because we have been making some really good progress over the last 5 years in making it easier for people to adopt children in Virginia, and making it easier for kids who are in foster homes to get permanent homes where they can rely on family to make sure they don't get into trouble, and make sure they have a good chance of getting a good job when they're out of high school or out of college. And so I'm most proud of those kinds of bills. But beyond that, there have been some bills that are of local interest. I had a bill related to safety at private dams. Now, many people wouldn't think that that was that significant, but some folks in the West Lee subdivision asked me to put in a bill that helped them address a problem that they're having at safety with their dam. The regulations were going to force them to invest about $1 million to upgrade their dam. And I thought that was a little much. So we put in a bill, and as soon as we put that bill in for these local folks, I got calls from all over the state from people who are similarly situated. So we've gotten the regulations revised to give people more options for how they remediate their dams, keep them safe, but not have to cost a lot of money doing that.
What kind of bills have you been involved with, David, which will improve education? We don't have a lot of time today. We'll try to touch on some of that,
Sure.
the pre-K, elementary, high school level. Talk about that if you
Sure.
would.
Well, the biggest thing I worked on, of course, education is #1 on my list. I'm not on education committee, and I'm not on appropriations. So I have to argue where I can to increase the funding. When the budget left the House this session, it included a 35% cut in funding for the city of Charlottesville and a 15% cut in funding to Albemarle County. I had to fight against that. And before the conference committee came out with their budget, which is a reconciliation of the Senate and the House, I was actively engaged in that process to make sure that Charlottesville got funded and Albemarle got funded. And at the end of the day, they both had cuts, but they were nowhere near where the House budget initially was. And I think that's a great victory for our jurisdictions.
Why is pre-K so vitally important in education? This is something people ask about a lot.
If you ask business people around the state and around the country, they'll say investment in children's education as early as possible has a great benefit on their long-term prospects for success. There's a lot of studies that have been done. And so Governor Tim Kaine, when he was governor, tried to push the pre-K initiatives. He got more money in the budget. There have been members of the House majority who have never liked that and have been gunning for that funding ever since. When the House budget came out, there were some pretty big cuts in pre-K education. Fortunately, a lot of those were restored, not all of them, however, because of the budget crisis we're facing. But we were able to keep the programs in place, and so ultimately, when the financial situation improved, we'll hopefully be able to get some more money in those programs because they're really critically important to young people as they grow older.
Another issue for a lot of people is charter schools versus public schools. What do you see as the role of the charter school versus public? How does that work together?
Well, we've had a charter school program in effect in Virginia for a long time, but it's probably one of the most restrictive charter school programs in all of the country. You really can't get anything chartered unless the local school division says yes to it. Actually, 2 of, say, the 4 charter schools in the Commonwealth are located in Albemarle County. And we have lots of people here who think a lot about charter schools. I think we have to open it up a little bit more. I think, you know, a little more competition doesn't hurt. Now, when you talk about vouchers, that's a different kettle of fish. That's when you're taking money away from the public schools and giving it to private schools. Charter schools is different. Charter schools create some innovation. If you go through the local school division, they know what's going on, and they can pass muster on the school provision. We did pass a bill this year that I thought was very interesting that creates the possibility for laboratory schools where a local school division would team with a university to provide some innovative programming and perhaps a school within a school. Again, the notion being innovation, creativity, and make sure that you benchmark your progress to see if it works.
That was one of the things I thought was so exciting, is that there's more university involvement in the schools at every lower level, and it makes complete sense, and businesses also. One of the most disturbing things I read, and I'm sure you saw this March 11th, was about a school in California, and we all know they're having their challenges. And she gets up at 5 in the morning, travels an hour and a half to go to a charter school outside of LA because she cannot, she wants to go to UCLA. It's her dream, and there are very poor schools in her area. Now, 1,200 kids are involved in this busing program. There was funding for it, and they cut it off. I think it's emblematic of what's going on with our education system in this country. First of all, what's wrong with the picture? She shouldn't have to bus out of her community to go to a good school. And secondarily, if she does, need to, we should have funding for these kids. So increasingly, I know we're going to be talking about education.
Well, that wouldn't have happened in California 25 years ago. And then there was a tax revolt, and they stopped funding their public schools. Great commonwealths and great states just don't happen. They're products of decisions, good and bad, big and small, that legislators make. And we need to make sure that we preserve a level of funding for public education, because we can't afford to let our system languish.
I agree. For someone who is considering entering the life of public service, David, because of course politics matters, what would be your best advice and counsel to people?
Get started locally and get started in something that you feel passionate about. And public service is not just about running for office. It can be serving on boards and commissions. It can be serving on a nonprofit board that has an impact on people's lives. I went to an event this last weekend for the Boys and Girls Club. What a wonderful organization. You don't think of it as public service, but every person who sits on that board, every person who goes to an event is engaged in public service, trying to help young people get ahead in society.
Oh, I think is vitally important, as obviously you do. David, many thanks for being on the program and sharing your thoughts with us today. We thank you at home for listening and for your participation. As always, we'd like to hear from you. We welcome your emails on any and all questions covered or not covered in the program. You can reach us at info@politicsmatters.org. We air on Saturdays at 8, Tuesdays at 8, and Thursdays roughly 3:30. Sometimes it's a bit of a movable feast. On Channel 13, Charlottesville Public Access. Thank you, and until next time. And thank you again, David.
Thank you.
I'm Jan Painter, and this is Politics Matters.